That story there about Asha Mulu, and that is what some Kenyans resort to. And Malecha, let me bring that to you, because there are those who'd argue, like Dr. Busira, as we are watching it, that those are quacks, and there are many people that have their lives come to an end in their hands. Is there a way we can work as government, as various institutions, to cope up to them and ensure that there's more numbers being showed up in as far as providing healthcare across the board?
Sophia, thanks for that. And this disturbing video is quite a revelation of where we are failing in terms of having the right standards and guidelines in place. And you look at it at 2 or 3 levels. From the executive level, you'd want to question what has the Ministry of Health put in place in terms of traditional healers or people who provide traditional healthcare services. What are the policies, what are the standards and guidelines that have been put in place, and how is that being implemented? Because there are people who may be legitimate herbalists or people providing traditional medicine, but what is the framework to be able to regulate them? And I know there's a bill pending either the National Assembly or the Senate trying to address this particular issue, but as usual, it has faced the same challenge that the health bill faced, where there's poor participation, no one is interested in pushing the bill forward. But what is most key, and what Dr. Bosire was raising as we were watching the video, who do you hold accountable? If the gentleman there died, who would you hold accountable? What role would the judiciary play? And that is what is worrying, because with the absence of a framework where you can hold people accountable in case something happens, that becomes a problem. If that was a qualified doctor registered by the medical board, then you'd be able to hold them accountable towards that level. But for this gentleman, all you'll resort to is probably a criminal case, because even if you file a civil suit, you may not be able to succeed to get any profit. So the key thing would be what frameworks are being put in place, how those frameworks are being rolled out, and who's being held accountable if the traditional healers destroy or mess up a person's life.
Yeah, and Dr. Bosire, there are those who feel the health sector perhaps just needs a rejig of the NHIF, relooking at that, having it now tailor-made to fit better the needs of Kenyans. Then there are those who argue perhaps a health commission. Doctors or other teachers have a commission that's looking out for their interest. In the judiciary, you have a JSC, that in the health service, perhaps a commission is what would fix the issues. In a broad perspective, there's a lot, of course, to cover in a short time that we have. But your thoughts, please.
I think, as I said again, we've mismanaged health for a very long time, and we are in a state where we keep putting elastoplasts on the wound and hoping it will heal. It has festered for 54 years. We need to sit down, get serious, and take a long, hard look and realize that if we're going to improve our health sector, the kind of changes that are going to be required are going to be very drastic, and people have to be ready to bite the bullet. In terms of legislation, I think I'll defer what my friend has just talked about. What we are seeing here is not an issue that there is no legislation. I'll give you a prime example. The Ministry of Health cannot touch these people. They are registered under the Ministry of Culture. So anytime the Ministry of Health will try to raise an issue about our traditional healers, about traditional medicine, and say, can we mainstream it? There is no person who is giving traditional drugs who wants to accept that. Let's take them to KEMRI and test them, find out what's the active ingredient, decide what is the dosage, and if it works, put it on our shelves. We're having that challenge. For me, that's a failure of legislation that didn't come now. Where we are, people are fighting to preserve themselves, and they're not thinking. It doesn't matter whether they're mainstream medicine or they're traditional healers. Everybody is looking to fight for their space, and that might not necessarily be in the interest of the patient. When we move on to NHIF, NHIF didn't come yesterday. It's been there. We're trying everything we can to make it work. But today, if there's a single Kenyan, as much as we think it's working or not working or wherever, if there's a Kenyan who's walking around with a voter's card and no NHIF card, shame on you. Because we are the people who will call for Harambes to help take care of your own, which will cost 100 times more than it would cost if we had been able to put in 6,000 shillings a year and be able to afford this. This fund works. As it is right now, NHIF has more money than it is actually disbursing for healthcare, because majority of the people who are actually contributing to the NHIF through their employer have a private insurance cover, so they hardly ever use it. Now, this is where mama somewhere selling vegetables, paying 150 shillings a month would benefit, and it is critical. Health Service Commission, we missed the boat. I think as healthcare workers, we have said over and over, we missed the boat. The public didn't understand where we were coming from, and we sat here and thought that health was so important. Somebody would have to be so stupid stupid as to bungle it up.
Yeah.
But we bungled it. And we have to go back and relook at how do we manage this. We cannot live a life where our country is swamped in crisis after crisis because of one strike after the other. Clearly, the message coming across is very clear that managing health workers is something that must be relooked. And people have to put egos aside at this point. This is really, really a matter of emergency.
All right. Professor Atwoli, comment on that as well, the Health Service Commission. And there are those who argue perhaps we have the health bill that was passed. Of course, it is yet to be assented to. But they recommend an advisory board for healthcare workers. Would that work as an alternative to the commission?
I think there is emerging consensus that there must be a mechanism that manages in a more organized manner the scarce human resources for health that we have in this country. And today, we at KMA or in the medical sector, we do not care what anybody calls it, as long as it's a mechanism that brings together all these health workers in the counties and at the national level and distributes them according to need and deals with their issues in a transparent manner where people can be held accountable. So that is something that I think there's emerging consensus in Parliament, in the political class, in the health sector. There's emerging consensus in that regard. And there are very many governors who also are coming around to that mode of thinking, especially now that people are having campaigning for elections. So it is an idea that the time has come. Let me say something about the clip that you just showed. I think this country, like many poor countries in the world, have fallen into the trap where the World Health Organization and NGOs are promoting third world medicine for our people. They are saying, because we are too poor, then we should be given poor medicine. And our governments are falling for this trap. They are falling for the trap that glorifies our past and pretends that it is good enough to take care of the health problems today and ignores evidence-based medicine that has been tried and tested over and over again. And people are dying because of that romanticization of the past, instead of looking at what problems do we have, what solutions are proven to have worked, and working towards that. It is not true that we can never have enough doctors to take care of our people. We will have enough doctors to take care of our people if we try. It is not true we will not have enough health workers for our population. We can have enough health workers for our population if we plan it and if we try. But we have given up and we have fallen into the trap of healthcare apartheid, where we are saying, let the poor people get poor medicine and let the rich people who can afford it get the evidence-based medicine that we know works. I think that is a pity, and we should move away from that kind of thinking.
All right. As we bring this to a close, our time running out. Halima, let me bring this to you. Part of the Kenya National Union of Teachers, you are on strike. Give us your last word. What's the way forward? Because you're remaining adamant and saying unless pen is put to paper on this, you're going to stay on strike. Of course, there are those who just purely see it from Kenyans are suffering, Kenyans are dying, and from your view, you're saying there are needs that have to be met and have to be met now.
We are part of the same Kenyans that are suffering, so we are also suffering. And I said, we have given this government enough time. This was supposed to happen in March, on 2nd of March. We are in June. So we have discussed and agreed. They only need to sign the document and we'll go back to work. If they sign it tomorrow, we'll go back to work. If they continue dilly-dallying and playing games with us, we are also ready to play the games.
Okay, so in your view, what's the hold-up? Why won't they sign after you say you both agreed?
In sincerity, I don't think they have any excuse. Because if we sat down with the employer for 6 months, negotiations are about give and take. There are some things we forsaked and other things we agreed. So where does SRC come in to say that we overdid the whole thing? Because we sat them with the employer and convinced them as to why we needed what we needed. So they only need to be sincere, sign the document, and we get back to work and help Kenyans.
Malacha people are hearing about scandals. 5 billion shillings, for instance, the other day lost. Donors pulling out. No money to pay nurses, to pay doctors. Where are we getting it wrong in as far as financing and, of course, corruption and accountability?
I think you're getting it wrong to the extent that we are not respecting Chapter 6 of the Constitution, and the agencies put in place to address issues of corruption are not playing their role. This government paid $1.6 million back to the Global AIDS Vaccine Alliance in one installment of our money relating to vaccines that had been misappropriated. The Gavi report clearly spells out who took the money, which organizations were involved, and to date, no one has been prosecuted.
Okay.
Money has been paid back. We do not know from which budget line, and people are still walking scot-free.
Right.
That's where we are getting it wrong, and it's going to cost us with the money that we're getting from development partners.
All right. I wish we had more time to continue with the conversation, but unfortunately, our time is up. Thank you so much for being with us. Alan Maleche, of course, Halima Aden, Dr. Nelly Bosire, and from Eldoret as well, Professor Lukoye Atwoli. Was a pleasure, and thank you for making time for us. We want to now take you, before we wrap up this hour of Kivumbi 2017, back to Nakuru County to get the results. Our returning officer, Ali Hassan, what have the people said?
Yeah, thank you very much, Sophia Wanuna. People of Nakuru have spoken. Na kabla ya kujua wamesema nini watu wa Nakuru, tuzungumze lugha nyumbani hapa, lugha rasmi, lugha teule na tukufu ya Kiswahili. Mwanzo watu wa Nakuru hapa hawajaondoka, angalia sura zao. Manake hawataki kura hata moja ibiwe. Wapo chonjo sana. Watu wa Nakuru mnalala ama mko chonjo? Wako chonjo, na kabla tujapata kura rasmi jinsi hali ilivyokuwa leo hii, tunaye hapa mmoja wa wale ambao kwamba tumekuwa nao leo hii. Atatueleza tu kwa kifupi, manake tumekuwa pamoja kuanzia saa 12 hadi sasa. Anazungumziaje zoezi zima la huu uchaguzi na afya nchini Kenya. Karibu sana ndugu yangu.
Imekuwa sawa sana hapa Nakuru, lakini kwa uhusiano wa afya hapa Kenya, sio hata hapa Nakuru peke yake, imekuwa na shida. National government inafaa ijue ni nini wanafaa wafanyie wafanyikazi wa afya. Imekuwa shida kubwa, wako na tarakilishi. They have the records of wale wenye wamekuwa wakihitimu. Wanafaa wapeane employment direct kutoka hapo. Hapana weka watu wengine ati lazima uende utengeneze application, na wako na records za watu from every department. Wako na watu, mbona waweke wafanyikazi wa afya waende wafanye application tena?
Haya, kwa hiyo anazungumzia zoezi lima na uandaji na usajili wa madaktari. Sasa ndo wakati ambao kila mmoja alikuwa anausubiri kwa hamu sana, na leo hii Jacob ndiye ambaye kwamba atatupa matokeo jinsi kura zilivyokuwa leo hii. Tunamwaminia sana bwana Jacob, ndiye katibu wa tume huru ya uchaguzi ya KTN Kivumbi. Yeye ndiye chebukati wetu. Mnamwamini watu wa Nakuru? Ma-agent wote wametia sahihi. Agent wa mitishamba alikuwa nani? Jacob, tupe matokeo.
Waliopigia maombi kura ni maombi na kura 9. Hospitali za kibinafsi kura 62. Hospitali za umma kura 101. Waliopigia mitishamba kura ni 23. Kuna wanaojitibu wenyewe kwa wenyewe ni kura 12, na kura zilizoharibika ni kura 3.
Mnakubaliana na matokeo watu wa Nakuru? Kwa hivyo hapa nimeona 29 mitishamba ni wengi sana, sawa na maombi. Kwa hiyo tuwashukuru sana watu wa Nakuru, ingawaje niwakumbushe kwamba hata kama ni hospitali za umma hata za binafsi lazima maombi kwanza. Nilikuwa nafikiri maombi angekuwa mengi. Watu wa Nakuru mmeniangusha. Imekuwa raha sana mtazamaji kwa nawe leo hii tarehe 12 mwezi huu wa Juni mwaka 2017 kutoka kaunti ya Nakuru. Tulianza naye Zubeda Kome kwenye milango ya saa 12 alimanzo akitupa habari. Sasa hivi ni Sofia Wanuna alikuwa na pomorosha matangazo haya. Joageo atakuwa naye baadaye. Niwashukuru sana watu wa Nakuru na watu waliofanikisha matangazo haya, na kwa ndugu zangu Waislamu na watakieni mfungo wa heri iwe ni saumu makbul. Watu wa Nakuru asanteni sana, na KTN News iko pamoja na Nyausio. Kutoka mji wa Nakuru, mie ni Hassan mwana wa Ali. Alamsiki. Zinzi na Hassan Juma. Take over, a boy and a girl.
Naam, asante sana Somo kutoka kaunti ya Nakuru. Naona Majamaa wa Nakuru wamechangamka kweli, maana pia wengine ambao wapo katika mitandao ya kijamii Zinzi wamechangamka sana, maana tulikuwa tunazungumza awali kwamba madaktari ni wengi, lakini wengi wanaondoka maana kidogo fedha si nzuri. Sasa wanagura pengine hadi nchi jirani, ndio maana
because of better conditions compared to Kenya. Okay, so let's take a look at some of the tweets that we are receiving from our online platform rather. And tonight we are asking you, where do you get your medical care for here in Kenya? Do you go to a public hospital? Do you go to a private hospital? Do you go to a herbalist? Is it prayer or
kama Zinzi Kibiku?
Take a look at this tweet. Devolution is good, but devolving health was the biggest mistake. Yeah, all right. The guilt of the life lost will forever haunt those who pushed it. So that is Stella. Let's take a look at another one. Right, having a doctor in a hospital without drugs and facilities is like having a cook without food to cook. The government must play their part. Okay. Let's take a look at some others. If we scroll down, Hassan, I'm sure we'll find others. And actually, the hashtag to use during this conversation is Kivumbi 2017. That's how we'll be able to take a look at some of your tweets. Have a look at this one.
Nurses are closest to patients in the hospital. Sign and implement their CBA.
Yeah.
They're needed back by
their patients. Okay, take a look at this one. It pains a lot that patients are left unattended. God is only our refuge in all times. Okay, so that's really what we're discussing today. We're really putting the spotlight on that. They looted 5 billion from Afia House, yet they can't pay nurses. Shame. That's the sign and implement nurses CBA. Now, something that this specific tweet literally gives you a background of what happened and what caused the 100 strike that we saw within the medical field. Plus, the reason why the Lipa Kama tender hashtag became one of the biggest trends we've ever seen in Kenya. What about this tweet?
I feel that it was wrong to devolve health to counties before proper transition. Kama sema kwamba ilikuwa vibaya kupeleka shughuli nzima ya afya kwa serikali za ugatuzi ama kuzigetua, manake si jambo zuri.
Okay. Health must be restored to where it belongs. Let nobody interfere with nurses' resolve. Okay, so some of your feedback there. Okay, so make sure you're keeping the conversation going. As much as the voting was happening in Nakuru, live there as you saw, here online we also are engaging our audiences online. So make sure you're tweeting us your thoughts and your concerns using the hashtag Kivumbi 2017. Hassan and I are keeping an eye on the digital platform as well.
Namkumbusha tu kwamba Sofia Wanuna atakujieni baada ya muda usio mrefu kwa habari kuu mida ya saa 3, lakini kwa sasa tunapumua kidogo, kwa hivyo usicheze mbali. Sisi tupo hapa kwa sababu yako. Ni Kivumbi mwaka 2017.